This is USMLE QA, USMLE material presented in a question and answer format structured similar to the first aid for the USMLE Step 1 book.
Question: What is a lysosomal storage disease? Answer: Lysosomal storage disease refers to a group of inherited disorders caused by the accumulation of various toxic substances in lysosomes due to the deficiency of lysosomal enzymes. Question: What is mucopolysaccharidosis? Answer: Mucopolysaccharidosis is a type of lysosomal storage disease characterized by the accumulation of complex carbohydrates called mucopolysaccharides in cells and tissues. Question: What is Hunter syndrome? Answer: Hunter syndrome, also known as MPS II, is a rare X-linked recessive lysosomal storage disease caused by a deficiency of the enzyme iduronate 2-sulfatase. Question: What are the findings in mild Hurler and aggressive behavior in Hunter syndrome? Answer: Patients with mild Hurler syndrome may exhibit aggressive behavior, while patients with Hunter syndrome may not have corneal clouding. Question: What is the deficient enzyme in Hunter syndrome? Answer: The deficient enzyme in Hunter syndrome is iduronate 2-sulfatase. Question: What are the accumulated substrates in Hunter syndrome? Answer: The accumulated substrates in Hunter syndrome are heparan sulfate and dermatan sulfate. Question: What is the inheritance pattern of Hunter syndrome? Answer: Hunter syndrome is X-linked recessive, meaning it is inherited from a carrier mother to her son. Question: What is the mnemonic for Hunter syndrome? Answer: The mnemonic for Hunter syndrome is hunters see clearly and aggressively aim for the X. Question: What are the symptoms of Hunter syndrome? Answer: The symptoms of Hunter syndrome can include growth retardation, joint stiffness, coarsening of facial features, cardiovascular problems, hearing loss, and intellectual disability. Question: How is Hunter syndrome diagnosed? Answer: Hunter syndrome is diagnosed through a combination of medical history, physical examination, enzyme assay, and genetic testing. Question: What is the treatment for Hunter syndrome? Answer: Currently, there is no cure for Hunter syndrome, but treatment options include enzyme replacement therapy, bone marrow transplantation, and supportive care to manage symptoms. Question: How can Hunter syndrome be managed? Answer: Hunter syndrome can be managed through regular monitoring, therapy to improve physical function and mobility, speech therapy, and early intervention programs to support intellectual development. Question: What is the prognosis for individuals with Hunter syndrome? Answer: The prognosis for individuals with Hunter syndrome can vary greatly, but it is typically associated with a shortened lifespan and significant intellectual disability. With proper treatment and management, many patients are able to lead relatively healthy lives. Question: Can Hunter syndrome be prevented? Answer: Currently, there is no way to prevent Hunter syndrome as it is a genetic disorder. Question: Are there any clinical trials for Hunter syndrome? Answer: Yes, there are ongoing clinical trials for Hunter syndrome aimed at improving treatment options and finding a cure for the disease. Question: How can people with Hunter syndrome and their families receive support? Answer: People with Hunter syndrome and their families can receive support through organizations such as the National MPS Society, which provides resources, support, and advocacy for those affected by MPS and related diseases. Question: What is the impact of Hunter syndrome on quality of life? Answer: Hunter syndrome can significantly impact the quality of life for those affected and their families due to the physical and intellectual challenges it can cause. However, with proper treatment and support, many individuals with Hunter syndrome are able to lead fulfilling lives. Question: How can the public support research for Hunter syndrome? Answer: The public can support research for Hunter syndrome by making donations to organizations such as the National MPS Society, which funds research aimed at finding a cure and improving treatments for MPS and related diseases. Additionally, participating in clinical trials and spreading awareness about the disease can also support efforts to find a cure.
Thank you for watching our Q&A format video. We hope this helped you learn, review, and retain knowledge needed for the USMLEs. For more information on this topic, check out the link in the description. Now, if you want to take your USMLE prep to the next level, be sure to check out all our courses, which are structured to follow along with the first aid for the USMLE Step 1 book. You can find us at usmleqa.com. And if you're watching this on YouTube, be sure to like and subscribe.